Hello, thank you for joining us today. My name is Sarah Kangas, a Wisconsin Department of Health Services epidemiologist, and with me is Autumn Linsmeyer, a Brown County public health strategist. We're going to walk you through the DHS data today, and you can find statewide data and county data at dhs.wisconsin.gov/COVID-19.
Brown County Public Health also put together a step-by-step guide for community members to be able to navigate the DHS data dashboards and find the same information we are sharing on our Brown County Public Health dashboard. You can find that step-by-step guide at stayhealthybc.com under Dashboard and Data.
We're going to use this step-by-step guide that BCPH put together to show you a handful of metrics.
To start, we will go to dhs.wisconsin.gov/COVID-19. We will then click on County Level on the right side of the page. This will pull up COVID data for the counties in Wisconsin. To find the number of confirmed, negative, and probable cases and the number of deaths, you should click on Cases and Deaths by County.
And each of our data visuals have an accordion drop-down of understanding our data. What does this chart mean? To help you interpret our data. And this table provides an apples-to-apples comparison of the impact of COVID-19 across counties, especially when we look at confirmed cases per 100,000 people or deaths per 100,000 people. The case fatality percentage describes the proportion of total confirmed cases who died of COVID-19. And you can also view how your county fits into the Wisconsin data as a whole.
You can also download this data by scrolling to the bottom of the page and selecting County Data. The next set of metrics we want to show you how to find is the cumulative total number of reported confirmed and probable cases by date of symptom onset or diagnosis. You can find that by scrolling up to the top of the county data page. This graph shows the epidemic curve and gives a sense of active cases over time.
And this epi curve shows us data by when someone's symptoms began or the day they tested positive if they were asymptomatic. And that's known as the symptom onset date. And the symptom onset date allows us to closely track when the illness occurred, allowing for more accurate contact tracing. And those who are symptomatic likely do not seek out testing the first day they experience symptoms. And it also takes time for the tests to be sent to the labs and the results to be reported to public health.
The next metric we will find is by clicking on activity level by region and county. This graph will show you the CDC burden rate and the positivity rate.
So this dashboard is useful to help communities and individuals assess COVID-19 activity levels in their area. It provides a variety of metrics to help local decision making. So you can toggle between case activity, percent positive, COVID-like illness activity, and influenza-like illness activity. And you can also view whether case activity or COVID-like illness is growing, shrinking, or remaining the same. We can also view past trends in 2-week increments. And the case burden over time can be viewed by clicking on the magnifying glass next to case activity. And each line here represents a county, and you can select Brown County to highlight it. And then hopefully in the next coming months, we'll see more of Wisconsin turn the lighter shade of blue within the first graph.
Now we will show you how to find the hospital capacity information. You can find that by clicking on Hospitals and clicking on the Northeast region.
So this information is broken down by 7 HERC regions. And the HERCs are Healthcare Emergency Readiness Coalitions, which support communities in responding to and recovering from disasters. This dashboard shows us the availability of hospital beds, ICU beds, ventilators, or how much capacity do hospitals have to handle a surge in cases.
The last metric we are showing you how to find is the percent of cases by recovery status, which you can find by selecting Cases and then percent of cases by recovery status.
And it's important to note that this metric does not tell us who may still be experiencing long COVID symptoms 30 days past their initial symptom onset date. Our surveillance system's purpose is to track and control acute communicable diseases and is limited in its ability to follow up with long COVID patients. This is still a good metric to view the percentage of confirmed cases who are living past the default 30-day period, or those who have documentation in the record that their symptoms have resolved or they have been released from isolation. We can also view the number of patients who had a confirmed COVID case but died from other causes according to their death certificate. This data is continuously under review.
Thanks, Sarah. We hope this helps you better understand the DHS COVID data. For more information, please visit stayhealthybc.com.